Hello, my name's Florence. Welcome to the theobspod. I'm an NHS obstetrician, hoping to share some thoughts and experiences about my working life. Perhaps you enjoy Call the Midwife, maybe birth fascinates you, or you're simply curious about what exactly an obstetrician is. You might be pregnant and preparing for birth. Perhaps you work in maternity and want to know what makes your obstetric colleagues tick, or you want some fresh ideas and inspiration. Whichever of these is the case, and for that matter, anyone else that's interested, the theobspod is for you. Episode 118, Postnatal Innovation, a chat with Sunita Sharma. Welcome, Sunita, to the theobspod. It is absolutely fabulous to have you here. I've wanted to have a chat with you and record it for simply ages. So Sunita is an obstetrician and gynecologist at Chelsea and Westminster and is just the best kind of postnatal guru I can think of. All things postnatal is Sunita. She's enthusiastic and energetically improving postnatal care. So, Sunita, welcome. Would you like to tell us a little bit about yourself?
Thank you very much, Flo. One, for the opportunity for me to sort of spend time with you here, and also for the attention on postnatal care, because it is the neglected child that needs to be nurtured and will grow into a beautiful flower given the opportunity to flourish. So it's really nice to have this opportunity. As regards me, I am, as you said, an obstetrician gynecologist. I have the lead for postnatal at Chelsea and Westminster, and I am postnatal lead for London Maternity Clinical Network and an NHS England clinical entrepreneur. So I do have the very privileged position of having gone through the maternity pathway myself, have been involved in frontline care, and along the line, the opportunity to learn co-designing and the power of creating solutions with the people whom it affects. And that means both those who are receiving our care, but also providing that care. And so that's been a very big change in how my inner desire to keep improving care actually took a steep step upwards, because it was no longer the kind of standard audit the data and make a system change and hope for the best, right?
Yeah.
So it sort of became more complex, actually, but more satisfying.
Yes.
In sort of working together with people whom it affects, and the fulfillment you get as a clinician to drive that even more. So the journey it's ongoing, and I think it'll remain ongoing because there's so much to fix in postnatal.
Yes.
But I believe we can do it. That's where we are at the moment.
That's lovely. So I'm interested because, like, when I started doing patient experience, as it was then, so maternity experience work, people were surprised I was an obstetrician. And I'm interested in you leading some of this postnatal work, because it's an unusual thing for an obstetrician to be leading, perhaps, because a lot of it is very midwifery focused. So kind of what was it about postnatal that I love the way you just described that flower, by the way, that was amazing. But what was it about postnatal that made you think that's where you wanted to put your energy as a doctor?
I think it's, being in the right place at the right time. For me, that is what happened. So my early career would be like how you describe, we are hands-on labor ward, kind of operative thing. That's what we do. And that's where we belong. And then it just so happened that an opportunity came along to respond to the complaint, concerns, and improving feedback for postnatal care. And I think that's the entrepreneur part of me that I need a challenge, and I do like a blank sheet to start with, because you have to conform otherwise and try and fix a solution that may or may not have been working. So this actually for me was, I'll do it. I'll take it on.
I love that. Do you know, that just makes me think of me. We've got so much in common, because that's also one of the things that grabbed me about women's experience of maternity care is no one's doing that. I could look at this and I could do whatever I want. I have freedom. You're right. So I love that that's your entrepreneurial, slightly different. Oh, I grabbed the blank piece of paper. That would be amazing. You've certainly taken that blank piece of paper. That's yes. So I can't remember how many years ago it was, but I came to Chelsea and Westminster and ran a postnatal Whose Shoes workshop with you. And that was kind of the beginning of understanding a bit more about what you were doing.
Absolutely.
How many years ago was that?
That was July 2017.
Oh my God.
I know. And
that's
actually
5 years.
And I'd already been on a journey leading up to the Whose Shoe workshop. And what I had realized is, the importance, like you said, about experience. And so it just so happened there were other places where my sort of perspective was widened in seeing how experience was guiding improvements. And so it was an amazing event. I mean, it felt like a festival of postnatal care. There were about 64 people, and there were people from community and hospital and parents and grandparents and babies. And I think it was such a joyous moment. And our poster, the Whose Shoe poster on the ward, summarized it beautifully as to the important themes, what matters. But I am guilty of the fact there are only 2 of them that I'm focusing on, and there's so much more to be done. But we were one of the first ones. I think we were the first ones to run specific postnatal ward Whose Shoe event at the time.
You totally were. And I remember it being a brilliant event. And I remember also the wonderful lady with her violin that came and played with Claire, your music therapist.
Yeah.
And her story about how that made her feel having music in the antenatal clinic waiting room when she was waiting for all her appointments. Yeah, I remember it being a really energetic, vibrant workshop. But I don't think you should kick yourself that you've only focused on 2 areas, because, oh my goodness, what have you done with those 2 areas, So, and like you say, it's a never-ending journey, isn't it?
But we are making progress,
Yes.
So on days then when the spirits are a bit down, I have to remind myself that actually we have started to make a difference.
Yes.
And what has been very successful is actually working with maternity voices partners, working with different staff members, and parents and actually grandparents getting in touch with me to say, I want you to know about my story. And that is so powerful in driving all of us to make the difference and continue to work at it. But I mean, we are nowhere near where postnatal care will be sexiest part of the specialty. We're not there yet.
No.
So we have a lot to do, because everybody can make a difference in that journey.
Yeah.
But we're not there yet.
Tell me a bit more about the grandparents, because I know you did some work with grandparents, and I think that's something that we sort of forget. So we're getting better at including dads and other partners, but remembering that they are part of a bigger family, perhaps we're not so good at. And I guess I've noticed that more now I'm a bit older and my children are grown up. And I'm not yet at that grandparent stage, but I've got friends who are, and therefore I see through their eyes what it's like when your children start having children and how you want to support and care for your child as they become a parent. So I think your grandparent work is really interesting.
And actually, it stems from, one was the Hishu workshop, and actually grandparents approached me later and I did a one-to-one interview with them. And then, like you say, in my own family, there were people, my family members having children and grandchildren. And when things didn't go right, I felt the sadness myself, and I was in a different country, and hearing the sadness of the grandparents and me being the aunt, or whatever kind of dynamics, and actually it opened my eyes to the wider support network that we don't see, and we don't. Our training hasn't given us the opportunity to sort of appreciate the support network to which people are going to go back to, and how they need to be nourished and how they need to be. And I remember this one grandparent who said, I feel sad. I've been replaced by Google. And that was so heartbreaking, because, the worth and value of the grandparent inside. But I saw the sadness in her face as she was sharing that with me. And that is what we need to do. We have to value the lived experience of the grandparent, what they can bring in the support that families need. They say it takes a village to raise a child, right? So we have to be empowering those support networks, right?
Yeah.
And if I ever, have money, because we run out of money with kind of quality improvement. but if I ever had money to sort of do little projects, the one that we're doing with the Beyond Birth Living Library, where one of the support network we want, and we have included in there, is actually grandparents supporting grandparents. Because like you said, you're still a parent, right?
Yeah.
You are still worried about the child who's given birth to a child, right? But they're still your baby.
Yes.
And you feel that responsibility, and you feel the desperation of how I felt with my relative being so far away and wanting to be there for support and not being there. And the sadness, so I want that to be better, because there can be so much more good that will come out at individual level for the grandparent, for the child, for the grandchild, if we tap into the opportunity to empower each one of them in what they contribute.
Yes.
So, all your apps for monitoring the baby, nappy change. I hear all of that with my nephews and nieces. You can do all of that, but actually the wisdom that your parent or grandparent or a relative can bring is irreplaceable.
Yes.
But we need to support each one of them in understanding the worth of it.
Yes. And I think COVID made that worse as well, didn't we? Because we had families unable to even see their relatives or parents when they were struggling with a new baby. So you mentioned there Beyond Birth. Tell me a little bit more.
So Beyond Birth Living Library, it sort of came about. I do the postnatal clinics. So I am in a very privileged position, like you said, as an obstetrician, to have time. And I'm very grateful to the trust in, Chelsea and Westminster, recognizing the need for that and supporting that. So I started doing the clinics from about 2015 onwards. And so over time, having reflected on what I was hearing, one thing was very clear. This is what people are sharing, is a support that enhances their well-being. Because we're very good at clinical emergency physical disorders, right? But the health and well-being component falls through the crack.
Yes.
And the more complex you've had a journey in pregnancy and in your birth and postnatal, the more is that need for recognizing you're not alone, that you're very justified in feeling how you feel, right? And that you're not being judged by how you feel. And that came across as a very big reflection of mine from hearing the stories, was the fear people perceived in sharing their concerns about well-being, because they may be judged as not being a good parent,
yes,
or not coping, right? And I mean, we all do it, right? That's human nature. I digress. And my daughter does not like to go to the 6-monthly dental check.
Yeah.
Very happy to go to the orthodontist, right? But not do this because she said he's going to judge me on my brushing. Right?
Yes.
So it's human nature. We don't like it where there is a chance we may be judged, right?
Yes.
And as a parent, new parent, first-time parent, you're even more vulnerable in this position. So we were very lucky that we had been doing work with, the Whoshu, the MatTechs, so had got an understanding and a partnership with our Maternity Voices partnership. So Sarah Espinan and myself and Clark, which was our NHS improvement organization. And I was very lucky to have a fellowship there. So it sort of all came together: experience, QI, methodology, insights of people's lived experience. And we got Health Foundation funding to transfer the concept of living library, lived experience supporting others. And as part of my Clark Fellowship, I had seen that in Sweden, which had been doing it for decades, of using lived experience and supporting people in their journey. And it's part and parcel of normal care. There's no judgment involved. You've been diagnosed with, or you are going through, and here is as standard care, the living library. And they've enhanced it, and they're way, way ahead. And I thought, actually, but there was a long reflective moment. So this wasn't a lemon bulb in Sweden. It was further down the line, that lemon bulb moment of actually what I'm hearing in the clinic and what the solution is. This, because the solution isn't getting one more midwifery appointment, one more health visiting appointment.
Yeah.
The solution is supporting the need. And the need is about how do we enhance well-being?
Yeah.
Right? How do we empower the parent? And it's like resuscitation, right? If you get the oxygen mask on, the rest will be fine. Okay?
Yeah.
So if you get the parent fine, the baby's automatically going to be fine.
Yes.
And so my focus has been on the parent, and parent being parent or grandparent. But if we get that right, their well-being right, everything will fit in. And so we got money, and we set up the Beyond Birth Living Library. We realized the complexity in NHS. It wasn't so easy to transfer the concept because Sweden, the team works out and they coordinate. With baby, we had to go through safeguarding, vulnerability, all the kind of steps in place to ensure it's safe. We are not going to harm anybody giving or receiving support. So that took a long time, which longer than we thought it would. And then COVID happened. And then we personally dipped the low ourselves because we couldn't implement it. And then it took us about 9 months or so to work out that actually we can do it virtually.
Yes.
And so it became a virtual support system. So now the silver lining in the cloud, right?
Yes.
Anybody, anywhere can support anybody, anytime, right?
Yes.
So that's because the Whoshu workshop, when we had done in 2017, parents had said they would like something in the community. And so we had been working on that, face to face in the community. But COVID, we had to adapt. We had to find a solution. And so now it is a website. You don't have to involve any clinician. You can yourself refer yourself to either receive support or provide support. And there are systems in place in keeping with the peer support program. Now, the USP, the unique selling feature of this is there is no judgment involved. That was very important for us because if you say, I am not coping, I'm feeling trauma, I'm feeling this thing, there is a risk that we may increase the barrier for people to access.
Yes.
So it works on very definitive criteria, like I've had a forceps birth, I want support. I've had a massive obstetric hemorrhage, I want support, right?
Yes.
So it isn't that I'm not coping, but I've never been through this experience.
Yes.
I need to meet another parent.
Yes.
So that is where the difference lies. And my vision, is that it should become part of our service. This is not an extra add-on. This is not something that people should seek out. It should be part of our care for parents.
Yes, sounds amazing.
Is what should happen. So that's Beyond Birth Living Library.
Amazing. So I know, so you were doing work at Chelsea and Westminster, and then you've kind of moved into doing work on a London regional basis, and you've been doing some work with health visitors and community midwives. And I kind of think, well, that's your entrepreneurial spirit, because that's difficult because they're not employed by the same organization. It's kind of cross-boundary working, isn't it?
Yeah.
So can you tell me a little bit about what you're getting up to there and why?
Oh, that's really exciting. Okay. So one is, the opportunity to meet people outside of your space. So I was very privileged that I was able to have the role of being the postnatal lead for the network. And I always feel like, all our training, we are sort of contained in the four walls of the building, and that's our world. And actually, this suddenly opened out a world of other people who have the same mission and vision. And it sort of gives the opportunity to do even more together and be able to sustain things. So the first piece of work that we did working with the Maternity Voices Partnership was actually acknowledging the challenges they were hearing from service users, parents, which was the handover of care. You know how in postnatal care in the NHS, there is the way the system is set up, you're with maternity services, you're on the ward, there's pressure, so that the need to go home as quickly and safely as possible. Then for most people, 10 days, you've got the community midwife looking after you. Now, the community midwife may be part of the same service as the maternity service if you are in the catchment of the maternity service.
Yes.
But if you have chosen to have birth elsewhere, you then go back to having postnatal care based on where you live. So, for example, Chelsea and Westminster woman who's come from somewhere else will then have the service provided by the maternity service that is, responsible for her community care. So they go there 10 days with community midwife, and then health visitors take on, and you've got your GP in the background. So already there are so many quick transfers that are happening in postnatal care. And if you have, a additional need, the community midwife may be involved till 28 days, right?
Yeah, and I think women aren't necessarily understanding that disjointed care. So I guess part of the reason for that disconnect is we're in London, where there's a lot of hospitals and a lot of choice. And for other areas, that isn't the same. They've got maybe one hospital. But I agree. I'm not sure when women choose to come to my hospital and give birth from what's officially outside our area, do they understand that their community midwife postnatal visits are going to be by someone totally from a different organisation? I'm not sure that that's explicitly clear, even that they're making that choice.
You're absolutely right. That we don't necessarily have the confidence everybody understands that. Plus also, there's a lot of focus on the maternity unit, right? So they choose and they are supported and should be supported for the choice of the maternity unit. So part of the London piece of work was to take away the variation in postnatal care wherever you are from, right? And so for us, we thought as a network, if we could enhance the handover of care and standardize that across the city, and these are bigger problems in cities like you highlighted, then we are working to the best within how the system is set up and not limiting people's choices because of their postcode, right? So we, first of all, worked with the team to standardize the discharge guidance and the information we give women, give community midwife and GPs. So that took about 18 months or so for bringing all the national guidance together, working with our MVP partners to get the language right so that it's empowering and supportive and helpful together. So we're working still with maternity teams on implementing it. So, and because there are so many digital systems and so many different systems across different maternity units, that is piece of work. So how do you ensure everybody gets the best information about themselves? So, when we give discharge guidance, is it personalized for the mother? And is it relevant? Because she won't have the time to go through the whole of, whatever resource to work out, this is relevant for me, this is not. So, we want to support personalized, holistic, supportive guidance in the postnatal period. So it seemed logical, having done the maternity services to community midwife, to move on to the next point of transfer, which happens very quickly, 10 days, right? So if you've had to stay in the hospital for whatever reason for 3-4 days, before you realize you've moved to the next professional.
Yeah, 10 days is nothing, is it, when you've had a baby?
Yeah. And so we were, we wanted to, again, address that handover of care. And one of the feedbacks that nationally we get is there's a lot of variation in the guidance that the parents receive. And if you're a parent and you're not necessarily from a clinical background, who do you trust? Who is right? Who knows my story? Who has really got control of my situation and knows this is relevant for me? And so, that experience feedback and all, this is what we need to address. And we can only address in a system that works this way, is sharing the personalized guidance. So for the community midwife to health visitor, we got really lucky. So, Maternity Unified Tech Fund had the bid for digital solutions.
Right.
So as a network, we put in a bid for standardizing this pathway across the region.
Right.
And it's a work in progress, but it is to create a standardized operating policy, which can then be implemented in however services work.
Right.
To this, so we worked with the MVP partners. But what I must come back to this one. So what the funding did, and I'll keep coming to funding because funding is a real big problem for postnatal care. But this opportunity gave us money that we could remunerate the time of our MVP partners.
Right. So important, valuing their time properly. Yes.
Yeah. And so we got money and we were able to have a who's shoe workshop. We were able to run focus groups, which have been run by our MVP partners, multiple ones. And we were also, and we're really pleased that they ran the focus group for staff members. So
amazing. Yes.
Yeah. And so they could hear the staff challenges and staff solutions. And so they have run focus groups. The staff survey has recently finished. We've had the Who's Shoe workshop. And we meet up as the postnatal subgroup of the network. And we've been invited by the health visit. We've had lots of connection created. But I think what has helped, and again, a silver lining of the pandemic, we all got confident with Teams, Zoom, whatever. And where you've had to physically go and you can say, I can't leave the session or whatever. But I can dip in for a 15 minutes meeting, right?
Yes.
And I can network so much more. And the same for everybody.
Yeah.
Right? So we had a meeting where I was hearing of, all the people saying, I'm from health visiting, I'm from early years, I'm an academic, the wealth of experience and insight and parents was so huge that I actually asked them in the chat to put the number of years of experience and insights they bring. And in that meeting, we were nearly 900 years of learning. Now, that was only possible because we've now got tools that bring us all together in an efficient, timely way. And so that's work in progress. So we're very excited. We're coming towards the end. So I think by the start of next year, that document will be ready for us to share with. So we've been working with the digital team, with the health visitors, with the academic early years, children's center, all of that. So yeah, very excited about that one.
I think you're just phenomenal, Sunita. I mean, when I listen to what you're describing and what you're doing and the enormous excitement and energy and enthusiasm in your voice and your face as you're telling me, it's just amazing what you've achieved. It really is. And I'm kind of going back to you saying, well, I've only done 2 of the things on the poster. Well, oh my God, like this is incredible what you're doing. You're really, like you said, an entrepreneur. You're really pushing postnatal care into the forefront and really improving it in ways you can barely dream of, really. So what's like your next kind of, I know obviously you haven't finished this yet, but what would your like ideal next step be? What's the next idea in your head for postnatal?
So can I share what we are doing, right?
Oh yeah, go on.
Yeah. So these are such exciting times to be innovative, but for funding, right?
Yeah.
And so I do want to share the Postnatal Digital Suite, which is our Chelsea and Westminster project.
Yeah.
And again, it's a co-design. And it came from that workshop also, all our service, everything from there. And what's the workshop? I mean, you'll remember it. What it did say was the women and birthing people's experience of very disjointed experience on the postnatal ward, with so many people wanting to do the best for the mother and baby, but everybody very siloed in their role.
Yes.
Including myself, right? And I, in those days, I would say, you will have to ask your midwife.
Yeah. Because
anything else other than what I am supposed to do, I really didn't know.
Oh, yeah, I get that. Particularly if they ask me something about the baby, it's like, huh? And actually, interestingly, I had someone do work experience with me and she, young schoolgirl, she said, why is it you can't answer any questions about the baby? And I'm like, but that's because that's the pediatrician and I'm the obstetrician. And she thought that was mad. So it's really interesting you're mentioning that.
So one of the themes in that poster was joint working.
Yeah.
Right? And then we continued on the design thinking work. And so we surveyed staff, focused group with staff and all of that. And, postnatal ward is mom and baby. So in our ward, there are 14 different group of people who are involved. And this is the first time that I sort of also had the opportunity through the Trust Leadership Program of having people who are not maternity come and observe our service and sort of see with fresh eyes, what are you doing? Why are you doing? And MVP partners observing and all of that.
Yeah.
And what became very clear is a frustration of everybody's working so hard.
Yeah.
But it's not joined up.
Yeah.
So we designed a real-time traffic lighted postnatal digital dashboard.
Right.
And we're very lucky. We sort of got recognition with a few awards. And the most recent one was the NHS Improvement Award for Digital Enablement of Services.
Congratulations.
And thank you. It's a team. It's the team, and it's the voices of the people who are giving and receiving care.
Yeah.
That is what has made this possible. And so, before I would have said exactly like you said, no, you'll have to, I would say, ask the midwife, all of that. Whereas now, because everybody who has a task is traffic lighted on that dashboard. So before I go, I can see on our TV, which is the replacement of the white down board we used to have previously, which will show me how many green or red dots there are for the task. So, if the neonatal check is still due, or if there is the prescription hasn't come, there'll be the number of red dots. The more tasks have been done before people can go home, the more green they are. So I do look at that before I go and see anybody.
Yeah.
So if I am asked the question, we can say, no, that all is done. Now your only thing that is remaining, wherever the red dot is required, and then you will be fine to go home. And what we found is that staff, because women know staff are so busy, they don't want to hassle them so when can I go? What will happen? And they just want easy access to this information. And anybody can give it, because now it's on the board, right? You've got 2 reds or whatever.
Yeah.
You're nearly there. That's all they want to hear.
I'm thinking, I want this. How do I get this? This sounds great.
So we did that. So that was our digital dashboard. And it's fantastic because it's increased our QI capability, right? Yeah. Because with anything, in the past, when the board was wiped off, any information data you had gets wiped off. And because mum and baby records are separate, you can't do your audit. So that before this, my biggest audit for postnatal steps was 50 clinical notes.
Right.
Reading through them and then finding actually it hasn't been written as to when they left the ward. And incomplete data. Whereas now, digitally, every step is captured. There may be a time lag, but it's digitally captured as part of business as usual, right? So you're not spending your poor SHO, midwife, consultant time trying to do an audit on something that should be as real time as possible. So that's traffic lighted dashboard, mum and baby together, which is the first of its kind in the world. So I'm really pleased, unless, we hear anybody else has one that brings them together, because that's what postnatal needs. You can't have 2 silos. Parents told us
completely.
You need joint working.
No, because I'm thinking postnatal ward, you've got midwife check, you've got obstetric check, you've got prescription that the pharmacist needs to look at, you've got someone coming to test the baby's hearing, you've got the NIPE newborn examination. It's just never ending series of check, this, that, and the other steps. And definitely a problem I recognise from all sorts of maternity workshops is women's frustration at, when am I going to be able to get home? Like, it's almost like I'm stuck in this place and you're not going to let me out, is how it becomes, or how it ends up feeling, isn't it, sometimes? But I love the way you're going, we were very lucky we got this money. I don't think luck's got anything to do with it, Sunita. I think you work very hard with your team to write really good ideas and bids, and then you get rewarded with the money, rightly so.
Thank you. I was just going to say an important fact, and I think this is probably not appreciated as much as it should be, that when CQC maternity surveys have been done, 44%, I think it is, who have said that discharge has been delayed on the day, right?
That's huge.
So it is huge. And whilst maternity services are having to close because they can't give one-to-one care, which in part can be staffing, but it in part can be because there is no physical space to give care, right? So if the maternity services are closing for hours, it has a huge consequence on a mother who has gone through her entire maternity care in one unit being transferred to another for the birth at the very last minute. How traumatic is that?
Yes.
Right? And if you then don't have the confidence that you have been as efficient and effective with your resources, which the survey is telling you, 44% said, I was delayed on the day.
Yes.
Then we really need to look at our operational steps.
Yes.
To avoid, something that we can do within the existing resources.
Yes. That's very true. Amazing. I feel like we could probably talk forever on postnatal care.
Can I tell you one? Can I tell you one more thing?
Yes,
and then
of course.
I promise.
You don't need to carry on.
So one more thing, and I think this is where it is. I was saying about handover of care and standardizing care across. The current piece of work that funding will help, that I'm working on with the team and with our service users who are extremely supportive, is how do you create equity in personalized postnatal guidance for any parent, right? If you do not speak English or you do not read English, right? How do you, as a service provider, ensure you have had equity in that? Because as a parent, as a new parent, you want to do the best for yourself, for your baby, for your family. But you can't if you don't understand or you don't know what is it that you can do. So, as part of this thing, the postnatal digital dashboard then took a phase 2, which was to try and use the technology, right? Because we can't translate and you can get a verbal translation. But, when you haven't slept, you're in pain, you're trying to get home, baby's crying, and you are sore. Getting a translator on the phone is not going to work, right, to the maximum. It is very helpful and is recommended and should be done. But it's not what's going to be remembered necessarily. So we use the same tool to get the postnatal discharge guidance across London translated into our top trust languages. So it's now available in Arabic, Romanian, and if there was funding, of course, we could do more languages.
Yes.
And if there's more funding, what I would like to do, and the funding for the MVP, and to try and get engagement of the people whom it affects, is to simplify that language. Because what we have found, and because I do speak the language, I can read the translation. If they are professionally done, they are purest, highest level of accuracy. But that doesn't necessarily mean it's the spoken manner. And in English, we have accessibility set at the level of the text, right? That there is. We haven't got that for our translation that we are using. It's high-level translation. So I do want to now evolve to the next phase, that we simplify it so that it is spoken. And improve further accessibility of those whose we know their experience outcome challenges are even more. And so we have to start with empowering them with information that is relevant to them, is understood by them, and empowers them to get all the support that we can offer as providers in that journey of nourishing parents. That's where we want to be.
I'm particularly excited that you mentioned Arabic then, actually, because I don't know if you've read yet the recent report on Muslims women. Oh my goodness. So I've heard Shai go here, who led that report, talk about Arabic speaking and Arab women having really poor experiences within that cohort of women who are already having a poor experience compared with Caucasian women or women of other religions. So yes, the making all these changes accessible to those women you know, starting out as a new parent in a country where you don't speak the language, and probably a lot of your family aren't here, they may be abroad. Unbelievably difficult. I can't imagine. I remember when I had my first baby, ringing my sister, who I was the first of us to have children, and telling her, it's a conspiracy. Having a baby is actually horrendous. And I wasn't talking about the birth. I was talking about the looking after, the feeding, the lack of sleep, the not being able to understand what your baby's telling you, and just the whole thing of being responsible for this tiny little person, and how daunting and difficult and impossible it actually was. And that nobody's ever explained comprehensively what it's going to be like. So to do that when you haven't even got something in your own language that you can understand, I don't even know how you would begin. So I think that translation, and the idea of translation in the spoken language rather than the more professional or academic language is just brilliant. Fabulous. This has been wonderful. So I always end with a zesty bit, something for professionals to take away and something for parents to take away as the kind of really key thing we want them to remember. And I suppose for me, I'm thinking maybe exploring the Beyond Birth Living Library might be one, but I'm wondering if you've got some thoughts on what would you really like people to remember from this conversation?
So I like lists.
Lovely. Okay.
So what I would hope, and I share a vision for us as NHS providing maternity services, it is to standardize supports like Beyond Birth Living Library for all mother and birthing people as standard package of care. For maternity units, I think it is recognizing that postnatal needs attention. It needs innovation. We can't keep doing the same thing again and again and hope for a different result. So we have to be innovative. We have to explore and need a solution that is sustainable. You know, we tend to do a quick fix here and there and move people around. And actually,
it's that kind of sticking plaster thing, isn't it?
Yeah,
and absolutely. You need the big vision instead, whole scale. Yeah.
So for individual maternity units, and I think it is still our responsibility as maternity units in handover of care. We have the expertise, we have the understanding of the journey in the last 9-10 months, right? And so we should be accountable for how we transfer ongoing care. And unless and until it's a metric that is measured, that is accountable, one is accountable for, there's a risk of it not being high in priorities. But I think whilst we as organizations need to realize that postnatal handover is a crucial part in an ongoing journey for which we should be accountable for. And I think as clinicians and anybody in maternity and anybody involved is to recognize the value of co-designing or working with, right? Because there's sometimes a temptation, I know what will fix this. And I've done it, I've done it for years. And I think, I know, this will fix it. And, so find allies and work together on the problem as equal partners. And then for women and birthing people and families, I think their voice is the most powerful and they must have it heard because there's so much suffering that is happening in silo, in personal this thing. And there isn't the visibility of what poor experience as new parent does. We can have reports and all, and yes, but actually MVP members and service users must use their voice because that is what is going to drive true improvement that's sustainable. That's me, really.
Thank you very, very much. I think that really sums it up. And it's been an absolute joy to talk to you about postnatal. And like I said, I think I'm going to have you on again to tell me the 16 other things that you've been up to. So thank you for giving up your time. And I hope everyone's enjoyed listening to us.
Thank you for the opportunity.
I very much hope you found this episode of the theobspod interesting. If you have, it'd be fantastic if you could subscribe, rate and review on whatever platform you find your podcasts, as well as recommending the theobspod to anyone you think might find it interesting. There's also tons of episodes to explore in my back catalogue, from clinical topics, my career and journey as an obstetrician, and life in the NHS more generally. I'd like to assure women I care for that I take confidentiality very seriously and take great care not to use any patient identifiable information unless I have expressly asked the permission of the person involved on that rare occasion when it's been absolutely necessary. If you found this episode interesting and want to explore the subject a little more deeply, don't forget to take a look at the programme notes where I've attached some links. If you want to get in touch to suggest topics for future episodes, you can find me at theobspod on Twitter and Instagram, and you can email me theobspod@gmail.com. Thank you for listening.